Hi everyone, I'm Dr. Vishnu, your pediatrics faculty at DocTutorials, and there's Aditya with me as well. And we have with us three amazing people, Dr. Atul, Dr. Anandi, and Dr. Yoganand, who have secured top 10 amazing ranks in a very tough NEET SS exam. And we are here to, delve into their minds a little bit, talk to them about not just their preparation, but also a little bit more. And when we started this, preparing these teaching modules 3 years back, I never expected that it'll have such a great response. So it's a wonderful moment, a very happy moment for me. We'll have such a wonderful discussion that we are going to with these people, and that itself is a very happy experience for me. So before we go ahead, obviously I'd want to introduce to you our three people who are three toppers, which I can call it, or my three juniors, which I'd like to call. So firstly, Dr. Atul, please introduce yourself to our listeners.
Thank you so much, sir. I'm Dr. Atul Govind, and I'm from Kerala. And I did my UG in Government Medical College, Calicut, and I did my PG in Trivandrum Medical College. And then after I completed SRship for 1 year, then I was started working for this past 2 years.
Great. So, Dr. Anandi, we have a lot in common. My wife as well is from Chandigarh and she is also from Chandigarh. So, please introduce yourself.
Thank you so much, sir. Yeah, I'm from Chandigarh. I did my UG and PG both from GMC at Chandigarh. Then I got married and moved to Bangalore. In Bangalore, I was working with Rainbow Hospital. And before giving this exam, I took a break of about 2 months or so. And here we are.
Yoganand.
Thank you so much, sir. Myself, Dr. Yoganand. I'm from Andhra Pradesh. I did UG from Government Medical College, Anandpur. Then immediately after that, I joined in SV Medical College, Tirupati, MD Pediatrics. Later, I took a break of like 6 to 8 months. And meanwhile, I was doing SRship in Chennai, Savita Medical College. Later, I give this NEET SS. Thank you.
All right. I think they all forgot to tell their ranks actually. But all of them are top 10 rankers here. Atul is rank 1 here. Anand is rank 10 and 4. So just letting you know, we are sitting in amongst the most brainiac minds, one of the most brainiac minds of the country. What I'll first start with is the most important question which comes in the mind of anyone who's doing MD Pediatrics or starting MD Pediatrics. Something which came in my mind also. Like when I chose MD Pediatrics, one of the reasons for choosing MD Pediatrics was that it was considered an end branch. It was considered an end branch. Like I had the option of medicine also, and I was like, I felt pediatrics is a better option because I was like, if I get tired of giving exams and everything, pediatrics is still an end branch. If the need be, then I'll give NEET SS and NEET or NISS, whatever it is, right? But I still have the option of it being an end branch. So the very first question is something which every junior of yours will resonate. Do they want to do sub-specialization or super specialization? When did you start thinking about it? And when did the switch happen? When did you think, okay, I should do it rather than not do it?
Was there a turning point?
Was there a turning point? Like this thing you saw and you're like, okay, nahi kar lete hain. Or you already had in mind from the very beginning, you were like, there are certain, for example, AIIMS is an institute where it's kind of drilled from day one that no, DM is necessary and everything. So maybe you're from that institute or your thesis guide maybe did. So what was the reason why you ended up doing or thinking about super specialization? So Atul, will start with you.
As sir said, initially I was not planned for that. I chose the pediatrics because everyone says it's an end specialty. So I was in the same mind also. So during my residency also, I just started only for that exit exam, MD exit exam only. During that, my course, second year and third year, there was immense exposure to subspecialties. In Trivandrum, there is pediatric neurology, cardiology, nephro, etc. At that time, I was aware that there is good specialties are there. And at that time, in my mind, there was something to do more. And at that, but I was not in practically was not in that much oriented.
Yeah.
After that MD exit exam, 1 year SRship, I was realized that I want to something extra, and then but I was at that time also I was not in to do again concentrate for an exam, entrance exam, etc. So I was started working for past 2 years. And at that time, as a general pediatrician, I was seeing that cases only not what see in that time. that only the fever cases or some respiratory URI cases, etc. So I thought I can't be a general pediatrician for too long. So I had to do something else for a personal growth or professionally. So in my working place also there was has an exposure to NICU and neurology also. The more amount of children are managed by adult neurologists. So we are referring them to adult neurology. There is less number of pediatric neurologists. Like. For past 2 months, one pediatric neurologist in the whole hospital or whole the area was managing these kids. Okay, so I was
like thinking on like okay, you felt a need for that subspecialty, and in fact it was being taken care by adult colleagues, and I would go on to say that they don't manage them well. They can get offended as much as they want to, but yeah. So, but you're absolutely right. A lot of people end up, specifically mentioned professional growth. You mentioned about the fact that a lot of people, after being in general pediatrics, they do feel the need for, after all, we all are nerds at the core a little bit, right? So we do feel the need
A little more.
do a little more,
degree
right? One more degree, and it does help professionally. There's no doubt about that. And yeah, some people enjoy the fact that they are a general pediatrician. It's a relaxed life. It's an OPD based, can be an OPD based branch. Some people like you felt like, no, I can't do this forever. I want to do something more. And you felt the need for that neurologist, taking care. Move on to Anandi. What was your...
So basically, when I joined MD Pediatrics, I was very sure, like absolutely sure I love pediatrics. I want to do pediatrics. Not seeing as an end branch or something like that, but I really like pediatrics. So I joined it, and because I liked it, even though the residency was like very hectic, but I used to enjoy it. Yeah. But after you finish your MD, most of us usually don't know what to do next, and because it's like a bubble when you're doing your MD, you don't know what is going outside that bubble.
Right?
Yes, very protected, especially in a government institute, I would say. So after I came out, I came to Bangalore, and then again there is a very different approach in North and South. I feel like in South, everybody, more or less everybody has 3-4 degrees or some fellowships or something to their name. So I felt that need that okay, maybe I have to maybe do a fellowship or DM or something. During my residency, like by the third year, I was like, I have to get out of this rat race. I am not doing DM, not at all. But as soon as I came here, I realized like maybe there's a need here to do some super specialization. So as soon as I finished my MD, there was this IAP fellowship exam. I personally liked all the branches. There was no specific branch at that point I liked. Like I was really interested in hemat-onc. I used to give all those quizzes and all. Then I was interested in neurology. I was interested in PICU. I didn't know what to choose. I got a good rank. I got 16th rank in that. So I was like, okay, I'll go for hemat-onc fellowship. So I joined Narayana in Bangalore, one of the best institutes for PHO. So 2 days into it, I realized, okay, no, I should take a step back because if you are going into a super specialty, what I feel is if you don't really like it, you are not going to sustain that 3 more years of grind. So I took a step back. I dropped out of it. It was a hard decision because getting a good rank, getting into something, then quitting it.
Quitting Narayana for PHO is obviously going to be tough. No doubts about that. Yeah.
So 2 days after I left, I was like, okay, this will be the best decision of my life and I will say it in an interview one day. So yeah, after that, I joined Rainbow. I thought that I'll take some time off. And during that, I actually developed interest in neurology. We used to get a lot of neurology cases. They're particularly challenging for a general pediatrician. So they're mostly referred to a super specialist. So that time I developed...
General pediatrician will write global developmental delay, refer to pediatric neurologist, right? So yeah, you're right. I'm just talking the reality, but yeah.
So at that point, when I developed an interest, then I thought like now I can do a super specialty. Now I want to do a super specialty because I'm interested in it. So that is around mid-August or so, I decided to start preparing for NEETSS.
And
Yes, sir. As you said, initially I was considered pediatric as an engineer. That was the whole point of choosing pediatrics. I had an opportunity to take a radiology, orthopedics, and the pediatrics. Among the all, I choose like pros and cons. I choose pediatrics. After getting into pediatrics, my institute was pretty hectic. Initially, I posted in PICU, NICU. Initially, I thought, okay, after the finishing this pediatrics, okay, we'll chill, so we'll practice as a general pediatrician. At the end of my first year, beginning of second year, I was more fascinating towards the intensive care. I really like the intensive care initially. So by the end of final year, I came to know, so it's not for me. Intensive care is not for me, definitely. I can't do that hectic works, that mentally, physically, it's exhausting, definitely. So definitely, and during my wards and rounds also, the every third, fourth case is having some neurological issues, particularly this neuroregression. That's everyone label it as a neuroregression. That's it. That is the end point of evaluation. Sometimes we'll take that case to this adult neurologist. I would say like they're not much into pediatrics. Their main practice entirely towards the adults. That is the bread and butter for them. They hardly give some insights. We will not evaluate much. We do not have that big pediatric neurology setup. Cardiology, we had like nearby SIMS cardiology setup. They used to evaluate all cardiology cases. But this gastro, nephro case, pretty much they can decently deal with adult super specialties. But pediatric neurology is the thing which general pediatricians definitely neglect. I do not know much about EEG. We have to refer every case to adult neurologist. They won't focus much on that. So I thought the pediatric neurology is the branch which really requires like for further specialty. That's what I thought, and I thought like I will not get with average rank pediatric neurology. It's definitely I cannot make like 100, well, even 50 rank also I could not get pediatric neurology. So that's why initially I did not keep efforts while preparing for this NEET SS for my first attempt. I just give like we'll see how it works. Yeah, I have given attempt. I got rank of 400. It's okay. Later I joined like SRship. Even there also, we never had a pediatric neurologist in my SRship also. We used to refer every case to adult neurologist. Many of the times we have to refer outside for the pediatric neurology evaluation. And during that time, okay, pediatric neurology is the thing for me. So I used to prefer for the INESS pediatric neurology part also. In that, I could not make it. I got a rank of 10th. Okay. Anyway, it's a NEET SS is there, no? So I prepared for the NEET SS. Luckily, I got rank of 4. That's what.
So, like we all now have heard that we have 3 future pediatric neurologists sitting with us. But let's delve a little bit deeper and peel the onion a bit. Like, what, if not pediatric neurology, what might have been your second
choice.
choices?
Yeah, I'm not before starting preparation. I'm not study specifically for not for pediatric neuro because I know that it's very tough to get the rank.
Very competitive.
In Kerala, it's only within 10 it will be close. So my aim was either neonatology or neuro first to get rank in within 30. So that was my goal, and so I searched the previous rankers and started to see the marks only. So I know that there's around 450 above. So preparing for that marks only. So when the rank came, I was really shocked. I was not expecting that.
So they say aim for the stars and you reach the moon. You were aiming for the moon,
you reach
and
the,
you reach the
stars. But that's okay because if you feel that you're going to like neuro gets over by rank 10 like you're saying in Kerala, becomes very daunting and it becomes very overwhelming to say okay, I'll get a top 10 rank and I'll get neuro and
the preparation
like
also gets
so very
it's difficult.
So obviously what you did is something which I'll actually advise to every aspirant. Don't think of okay, I have to get a 5 rank, 10 rank or 20 rank. Think that you have to prepare well, maybe like a 30, 50 or 100 rank you target. Do your preparation thoroughly, and then on the exam day you can be numero uno, right? You can be rank 1. That's a very perfect approach that you actually took. What were your second choice branches if I'm Anandi and Yogananda?
I don't think I would have done
Anything
else. Yeah.
So she has left PHO anyway, so she knows ki I had
No,
definitely.
I was expecting something because she said she liked everything. So, but yeah, it's good that maybe after
you're clear about your goals, right?
Yeah, after leaving, she would have been like, okay, now to be clear, that is my first step.
And she said, right, like I'll come on an interview and I'll tell you that was the best decision of my life.
Mine would be definitely neonatology, sir. I do like neonatology. Definitely not pediatric intensive care. I do know the pros and cons of pediatric intensive care. Even if you are not on duty, you will get 2 a.m., 3 a.m. calls. You have to be in PICU. You have to do some kind of intervention. And like neonatology, you can manage some sort of like with even the general pediatrician also, you can manage through calls. But pediatric intensive care is definitely, it's not kind of thing. That's why I would choose pediatric neonatology, if not neurology.
Now we'll delve a little bit more into preparation. When did you guys start preparing and everything? Like all of you said, you initially, obviously, all of you took a little bit break. You worked, you explored, you even joined a fellowship for that matter. So when was when did you finally decide? Okay, I have to give NEET SS, and this was your essentially a journey, right? Okay, 3 months, 6 months, and a kind of a side question I'll also ask that when did you guys do Nelson? We all know that the questions are going to come from Nelson. Nelson is the bread and butter as far as making MCQs for NEET SS is concerned. So, when was the Nelson studied? Was it studied, were you thorough during your MD itself? Did you study it afterwards? And when did you actually start preparing in an MCQ based manner? So, this time we'll start with Yogananda actually.
To be honest, I did not do well Nelson completely. I did neurology part in and out because I prepared for the INSS. I was very good at the general pediatrics part from Nelson during my PG days and all. So after that, I'm pretty sure that I am not going to finish Nelson, sir. So I find some kind of shortcuts. I choose a platform for videos. Whichever there is the lack, if there is some lacking concepts and all, I used to go back to the Nelson, so particularly that kind of missing topics which are frequently repeated, and if the topics which I think that these are definitely important for the NEET SS. Sometimes I do start with MCQs. If I find some MCQ which I'm not covered, so I'll go back to the Nelson and I'll check whatever the concepts I am missing. That's how I started. I did not start from page to page. This is not my preparation strategy. I do always stick to important topics first, then I'll choose the lackness wherever I'm lacking. Then
I'll go back to Nelson.
I'll go back to Nelson.
So essentially, you did a retrograde kind of approach where whatever Nelson you had read in your MD, general and neuro you read because of INSS. But for the rest of the Nelson, you were like, okay, I'll first do the MCQs first, and if I'm not getting something correct, then I'll read the explanation. Then I'll go back to Nelson and then put it into my notes rather than going to the Nelson and getting it back. When did you finish your MD and when did this kind of preparation start, if I may ask?
I finished my MD in May, sir. Last year, May.
Last year, May.
My exams finished in January itself, by the end of January, but I had a course due. I finished in May. So after NEET SS only, I started my preparation, sir, proper preparation. I started from Nelson only. I read some chapters, but I was not very clear about can I finish this. Even if you start Nelson from page to page, we don't know what are the topics or keep on repeating. So that's why I used to go with PYQs and particularly grand test from the DocTutorials, that chapter-wise mini test. I used to go through that, and any topics, if I'm lacking in concepts,
then you will go back.
Then I'll go back to the Nelson. I'll read the topics in and out. If not only Nelson, I'll go through some kind of articles. For example, for neurology, I used to go through Fenichel, Simon also sometimes. Yeah. That's how it was.
So it is essentially a retrograde approach where you focus essentially on important topics and PYQ topics rather than a thorough reading of Nelson, right? If not thorough, you did a thorough reading of Nelson, but of important topics, not a page-to-page reading of, not a page-to-page reading.
If you take the infectious disease, it's impossible to do that.
And I think that's a perfect approach, to be very honest. If you feel that whatever Nelson you read in MD is fine. After that, getting to a retrograde approach, even I would say is the better way to do. What was your strategy?
So basically, I have a habit of making notes.
Okay.
I cannot, read without making notes. So during my MD itself, I had read a lot of Nelson. I already had my personal notes. Yeah. So I started this studying from around mid-August.
All right. So you finished your MD in
February.
February. Okay.
Last year. So mid-August. At that time, the exam was supposed to be, I think, in
November.
November,
yes.
Yeah. So I didn't think that I had the time to read and go through the Nelson again. I directly picked up the DocTutorials, not even notes, just the question bank.
Okay.
Because we all know that all these exams are MCQs, MCQ based, and we have to do MCQs and MCQs. And so I started with the MCQs, even though I had not read the topics. I just did the MCQs just to know which are the important topics and retain something. So one round of that whole question bank I did like that, along with reading the important topics that used to come up, which were recurrent in those MCQs from the Nelson. And alongside that, my notes were going on. So a mix of notes and the MCQs were going on. When I finished my notes and the MCQs, then again I did a second round of QBank. So that time I could relate more, I could retain more. So, and in the end again, during the revision time, again, those notes and the MCQs, which I had bookmarked, and some special elite tests or mini tests that I used to. So mostly MCQ based.
MCQ based practice was the one key. But I think what I'll ask Atul you also, by the way, your strategy also. But what a kind of a common theme I can pick from both their cases is like you finished in May, you finished in, you started your preparation in August for that matter, finished in February. You don't need, you don't need 1+ year to crack the exam. You don't need that. I would say any 6 month of a dedicated preparation with MCQ based practice. Like she says, she's absolutely right. Like, exam is MCQ, you should do MCQ, plain and simple, right? Do your Nelson and your MD properly, and after that switch to MCQs like both Anandi and Yogananda did. If you finish with your MCQs, then go back to Nelson. That's the better approach rather than trying to finish Nelson. And I think a lot of aspirants do make this mistake that they feel that their Nelson was a little inadequate, read inadequately during their MD. And I'll be very honest, there's no such thing as inadequate Nelson because Nelson is too huge. किसी ने पूरी नहीं पढ़ी है, मैंने भी पूरी नहीं पढ़ी है, being very honest about that, right? Nobody has read Nelson fully. Whatever you have read during MD, because you need to read to pass, that's good enough. Come to MCQ practice, like she did, the QBank practice, the doctoral QBank practice, you do it properly. You go back and then read whatever important topics and PYQ topics are. I think that's good enough for 3 to 6 months. If you do that, you will definitely get a good rank. Now the rank 1 strategy.
Okay, sir. Same of all. My strategy was I have to finish it in 6 months because I started seriously preparing from July onwards, and I had attempted 1 year back also. At that time, the question was somewhat from the Nelson, then fact based, etc. So I got a rank of 282. At that time, I was not at all prepared, and only from that MD knowledge, and I didn't practice any questions at that time. So I realized that if I put some effort on MCQ practice, I will get a decent rank. So at that time, I subscribed that DocTutorial QBank series. So my strategy, my preparation was entirely evolved around that LI test. Because that is in every 2 weeks. So I started for that, divided the whole things into subjects, and then follow that LI test accordingly.
You basically followed the schedule of LI test for your making your own schedule.
Then under the core, the subjects was I started to watch the PYQ videos, and I write all the important topics from each subjects. Then I started to read from my note. One advantage that I got that I had some note, around 70% notes, my handwritten notes from the Nelson during my MD exit exam. That includes the most of the important topics for the exit exam only. So I was, I could find that the most of them are also similar.
Overlapping with the and the important topics.
Yeah. So I started like that only. So in a 10-day period, I was started from QBank. Then I was just refreshing that notes and added the point from the Nelson. So I seriously that important topics I studied in depth from the Nelson and tables, images, etc. Then I started doing QBank and the mini test. The previous all mini tests like series, there were only 10 questions. So from one subject only 10 questions. So I used to do in daily basis in my work time also. So and then I attempted that LI live test. So I had a good decent rank I got. Then after that, the PYQ, that LI discussion videos helped me very much. So to concentrate what all things I am lacking, then again back to the topics, and again I write this, etc. So the sequence of QBank, doing mini test, and then LI test. That was worked me for all subjects.
So basically, you essentially did QBank. Anything lacking, you added to your notes. You did mini tests daily, and then in 2 weeks, you were completing that particular system and subject, and then giving that elite test, and then watching the discussion and understanding and everything. Since you specifically talked about discussion and the videos of the elite test is something which is close to me, Vishnu, and Divya, because we ourselves make those elite tests, and we try to put a little tougher question from an examiner's mindset, but important questions. No question, I would say, I think all of you will agree that the elite test, they kind of approximate the exam in a good manner in terms of the kind of questions that actually end up coming. Amongst me, Vishnu, and Divya, which was the best as far as discussion was concerned? We won't mind. There are only 3, so.
I think the
See, if you take my name or Divya's name, I'll be happy. The only person I'll be offended is if you take Vishnu's name.
I think all the three were.
That's a
so
very
good.
diplomatic answer.
No, because
One. See, don't worry. Nobody's going to ask you second and third. One.
I think so only.
Okay, thank you. No, I didn't want my name. I thought you'll
Because
actually take the name.
I'm pretty much weak in that hemato-onco subject. So I was not really like to read an entire thing from the Nelson. So I started initially from your video and previous LI test discussion video. So I got that idea where to focus, that prognostic factors and dot stables, etc. So I just read it thoroughly from that Nelson only.
I think the reason he liked me is because it was his weak
Yeah.
subject. So that's the reason and everything. But
I think also students should, at least know that we also have this PYQ video bank, which I always recommend because we were discussing, just before we started the podcast, but this time the exam was tough. Yeah, but the question topics were same. The depth was more.
a little more.
Yeah, but the topics were same, the areas of focus were same, and because of that, that is where you can at least to understand where the previous questions have come from, to know the important topics you can.
So I think I'm pretty much famous for making, at least in the NEET PG segment, I'm famous for making PYQs preparation PYQ focused. But the fact remains that the PYQs are important for any competitive exam, be it your NEET UG, be it your NEET PG, or be it your, for that matter, NEET SS.
Chartered accountancy.
है ना, right, chartered accountancy, IIT, JEE, you take any competitive exam, UPSC across India, you cannot have a preparation which is not PYQ based, right? Elite tests are actually essentially, let's put it this way, they are PYQ plus tests.
Yeah.
We take PYQs, we modify them, think from an examiner's perspective how we can change them, make it a little tougher. It's something which is very close to me, Vishnu and Divya's, that because we take an effort to make those 20-25 questions, and especially in their discussions, and like Atul used it, like actually that's the goal of elite test, that you get a schedule.
You make a schedule.
You can make a schedule and you can finish the syllabus in 12 weeks to 4 months, and like 6 months you will be done with your preparation and everything. Next question, this was a question which was asked last time also, and I'll ask this. So people do love DocTutorials QBank as far as pediatrics is concerned, because very Nelson based. It is not too tough, it is not too easy, it is
I'd say ours is the best. I mean, it's not just for the sake of it.
Yeah.
Yeah, it's
but amongst the grand test, elite test, and mini test, these are the three ways you essentially test yourself on the platform. What was your favorite mode of testing yourself?
I think overall it is grand test only.
Grand test.
Mini tests.
Mini tests. Why specifically mini test?
Because I could do those like 20, it requires only 20 minutes. So you can do it
On a daily basis.
On a daily basis, even anywhere actually. Even in the ambulance, I used to just finish one mini test. Okay, done.
I think this is another thing. Mini test helps you building discipline. Like daily, at least 10-20 questions you can do, and you will get into that MCQ solving groove, which is important.
Also, because this time, now the exam has become these block wise, although it's essentially similar, but this block kind of looking the questions, looking at the questions as a block of 50, you can develop that, because you can't come back to it. So you have to do those block. 50 in so that also.
And your favorite?
Definitely mini test, sir. Because of that only I choose DocTutorials, because the DocTutorials, the mini tests are like a chapter wise. So, my preparation also like that, sir. If I open that particular mini test, I'll choose all this, I'll do all MCQs, I'll figure out what I'm lacking, I'll go back through that Nelson borders. If I do that grand test, there will be 150 MCQs, I can't attempt to everything. So that's how it started, sir, actually.
I think that's actually every one of you, like anyone we talk to, they all agree that mini tests, I did this today, let me give a mini test, and I'm kind of done with that thing. And I can give it in an ambulance also, like Anandi was saying.
And other thing is, like Atul used the elite to make, structure his prep. You can also use the mini test to structure your prep. That is something that.
Next question I'll ask is, this year's NEET SS Pediatrics was a little tougher, or very tougher, whatever you want to call it, as compared to last year's one, right? So, when you guys were giving the exam, how did you keep your, a lot of people lose their cool, they will see 3 tough questions and they'll be like, I've essentially ruined, this year is ruined, I have not prepared well, and they'll go into that panic mode and everything. How did you keep your calm? Obviously, MCQ practice helps. I think if you have not given MCQs, then obviously you will panic on the exam day, definitely. But what was your strategy on the exam day?
Yeah, when I started to attempt the exam, I felt it was very difficult because more amount of there will be questions will be 3 or 4 lines, and more amount of conceptual, image based, etc. This time or last time there will be correct images from the Nelson only, but this time they asked more amount of practical patient images, clinical images, etc. And also my in the grant test, what was helped me a lot is the doing the grant test. Because the time bound, so I was able to do that because and also one thing was the time consuming. The time management was very essential because in this time there was many questions. I hardly get time. I didn't get any time for that completion also, and so that the grant has helped me a lot to
Complete everything,
complete
everything in
everything.
time and a half. In your case, what was the exam day experience and
So basically, I was preparing for INI Neuro before that. So I was very disheartened. It was the first time I gave it, but I was very disheartened that, okay, I didn't even get an interview call. I qualified stage one, but I didn't get the interview call.
okay?
And in my mind, there was this ideal NEET SS preparation plan that should have been followed for 6 months. Like you said, that it is in our mind that we should read the Nelson completely, or more or less like 80-90%, and we have to do so much MCQs, we have to revise so much and all. So in my mind, it was already ruined. It was not the exam day that was
But
going
then
to
you went in with that
I
low
was
pressure as well, no?
extremely chill, to be honest. I did not care. Like, I already, after giving NEETSS, I started preparing for
For the
INI,
next
next INI.
analysis.
So I was extremely chilled out on that day. So it's like, I don't care. But it was definitely tough. And
But I think the chilled out attitude helped.
Yeah, I've
it
always
actually did.
noticed that, at least in my case, the first exam that I give in that session, that doesn't go well. Once that, that jitters and those nerves go, then the next exam is, my best exam usually, because it comes
It
in with a
happens with
lower.
you. It has happened with you also. I think your NEET SS did not go
Yeah,
that well,
yeah,
but you gave
yeah.
INSS without chill,
With,
and then
yeah,
you
yeah,
got a
don't
really
care
good
attitude, yeah.
rank.
I did not expect this kind of tough exam, but deep inside I was happy the exam is tough. This is what makes me stand out among all.
Ki others are feeling it's tougher
But
than what I'm feeling.
that's a great way to look at it. To
Yeah,
be
very
very honest, like very
positive.
positive outlook. Ki tough hai to kya hua? Mere ko aata. Like I
Yeah,
know it.
yeah.
Like so
And
that's a
one
very
more thing is the statistics part, sir. I did well for an INSS thing. There was like every third and fourth question was in first section, statistics one. So okay, so many of people will overlook for NEET as a statistics part, but I did very well in statistics part. And many of questions were like more of like clinical. So, for example, there was a question on strep typhus. If you give dogs into the child is having a deranged LFT. So, what you do next? These things and all I learned during my PG days in rounds itself. Those things really make me happy actually. There are some numericals, calculation based things. Those things I left actually because there was not much time to do that. First section, there was little time lag, sir. And second section, I finished like kind of 10 minutes early. Third section also, I felt little tougher. But overall, after giving exam, I was not sure how well I was done. But deep inside, okay, this is anyway going to help me. That's what I thought.
More to add, sir. In the same feeling, as I am studying only for the NEET SS, I was not given and I completely skipped the statistics
Statistic parts.
because last year also there is no question from the statistics, so I completely skipped that. But I was started seeing 6 or 7 questions, so I completely skipped in this exam also. So at that time I was feeling that pretty much low at that time. Because in last 6 months, if you are not revising something, we are not confident to do that. In my case, the statistics was really shocking.
the one thing that was really shocking. But I think this is a lesson. Like everyone should know that do their statistics.
Yeah.
It means that your other subjects were so good that they
Yeah.
actually
Even
covered
after
for
leaving
even after
stats.
listing stats, you were able to get a rank 1. But not everyone is that lucky. I would say that this NEET SS proves that. So you will have May INSS. NEET SS likely will be occurring in the month of October next year, probably when the next batch passes out. So you have good 10 months. Anyone who's in the final year or preparing for next year's NEET SS, you can don't overlook statistics. It won't take more than 1 or 2 days, but you will have 6-7 questions if the pattern holds. You will
I
again
think you
end
can
up.
just make small notes for stats, keep it keep it aside. No need to, keep on revising that.
Revising it.
But just before the exam day or, the week before the exam, just go through it so that as we can see in Yoganand's case, that became kind of one of the differentiators. Because that would make it others might not have read it or might not have revised it. So that is something.
In the questions which are asked in statistics, they are very basic.
Basic
things.
questions.
Yeah.
Test of statistical significance, the mean, median, mode things. Everyone will easily do it. So not that tough. One question on confidence interval, it was calculation based. That is little tough, but rest of all 5-6 questions are basic questions. Just if you give one reading, we can easily solve that.
Any other secret that, like he told his secret was, this
Statistics.
statistics. Any secret or anything that was, gave you a very high yield, something like flashcards, or what was your highest yield, content in your preparation?
Like her secret was being very chill on exam day.
Yeah.
And the other thing is, please don't leave any question. You won't be as lucky as him. Please don't. Statistically, please don't leave any
Fair
question.
point. Makes sense.
I think
Please.
I'm a big advocate of that.
Yeah.
Although some people still have that. See, what I feel is even if you put, there are infinite questions, you put B on everything, still you end up being positive. So I'm always on that side. But yeah, it depends a little bit on luck. But
I would say leave 5 questions, but not more than that. If you have absolutely zero idea about any question, leave those questions. How many questions did you leave?
Yeah, I given 138. I skipped 12 questions,
you
but
skipped
the number of wrong questions was
Less.
less.
But if you look at him, he did not know anything about statistics. So he left 6 questions, 0, and he left 6 from the remaining one. So it's not that he left like 138 might seem like a lot, but he was very selective in leaving also. Like, I would say that, yeah, sure, go for the kill, no doubt about that. Don't blindly go for the kill. A calculative guess is a little more
I am
heavier.
In plus 4
Yeah,
minus
plus
1,
one
you
minus
can,
1 by
in
4,
INR,
I'm like,
definitely.
go for the kill.
Plus 4 minus 1.
Yeah, because
I would suggest even if you eliminate one option also, you better choose something.
That
Yeah,
I would agree.
100%.
That I would agree. If you eliminate one option, you should definitely go for the kill. In his case, he couldn't know about anything in statistics, 6 options, so that's going like that should be the approach. If you eliminate, he's absolutely right. If you eliminate one option, mark it. Take a guess and mark it. Definitely mark it. One question actually, a lot of people do ask me in the DMs also, ki, sir, I'm working and I'm not able to prepare, right? Or can I prepare while working, or do I need a break? Do I need a small breather break, 2-3 weeks break? Should I take a 2-month break or something like that? In your case, we did talk about a little bit about this, but can you tell, did you actually take a break from your clinical work? Like all of you were working, and how much duration was you were totally focused on NEET SS preparation and you were not going to the hospital or not seeing patients, or you were continuing seeing patients maybe on a lower scale? And what did you, and what would you advise to any junior who is, a lot of people do come from a little bit of financial constraints, they have to keep working. What would your advice be to such individuals?
I think it's I'm started prepare for last 6 months. Even though I was started working at that time, 9 to 5, my duty was there. So after that, I will study around 4 to 5 hours daily basis. Then last 1 month, I took leave from all that, and I seriously prepare around 10 hours.
So basically, for 5 months you were on 9 to 5. Yes. You were working and you were preparing. And last 1 month is a focus version. What was your journey?
So I was also working for about 4-5 months, and then I took a leave for about 1.5 or 2 months. I think 4-5 plus 1-2 is
a good enough.
Yeah.
In your case?
Same like her, sir. I was working as a sir for 5 to 6 months. After INSS exam, I left, sir. I left for almost 40 days. For INS interview also, I prepared for 10 days like that. And so almost I could say 30 days I took for proper NEET SS preparation.
I think this is a good enough picture, fair enough a picture. If you have a 5-6 month preparation timeline, 3-4 months you can obviously continue working, and for the last 1 month or maybe 45 days, you can not do anything and be very focused in your ones. Everyone had a exactly similar thing. So it is not that you have to stay at home for 6 months to prepare. Don't do that. You can keep on working, keep on earning money. That's also important. And 1 month prior to the exam, be very focused. And I think what he said is also, I would actually advise that give INSS with all the rigor. If you get through, great. If you don't get through, you usually will have 1 month after INSS. That 1 month, you take the break and study for 10 to 12 hours, go for the kill and everything. Yeah.
Yeah, I think it was a great conversation. And also anything specific, like one line or something that you would tell your juniors, like to with respect to academics or non-academics, anything specific, Atul?
Cracking any exam, the main thing is to identify the course, what was to be asked in that, and revision. This is the key for cracking any exam.
I would say enjoy learning and zoom out a little. It is not just about the exams. There are a lot of things that are going on. And if you really like something, then go for it.
I would suggest don't aim ranks during PG days. You aim for your clinical works, you stick to your basic words and all. You may see a lot of cases, you read about that. After that, get into what you really want. Then you prepare your strategy and all. Like from beginning of residency, I would not recommend to someone to take something else. You prepare for the NEET SS. I would definitely not recommend. Basics is the you stick to clinical work, you evaluate the case, you learn from the book, then you plan your preparation.
We'll end the interview
Yeah,
on
I
this note.
think we had a great talk. We tried to delve into their minds as people and as toppers of this exam. We'll keep in touch, Anandi, Yoganand, and Atul. And it was a very nice
Nice
session.
discussion.
Yeah.
Thank you.
So
Congratulations
much.
all over
Congratulations
again.
again. And thank you.
Welcome to junior residency all over again. All right. Thank you. Thanks a lot.